eye surgery to enlarge small eyes and get rid of dark circles under eyes? I have dark circles under my eyes. According to my mother, I was born with them. I also have very small eyes. I would like to have Lasik so I no longer have to wear glasses, but I am embarrassed about the state of my eyes. Is eye surgery a good option for me? Also, the lacrimal gland in my right eye was removed about 9 years ago, and so that eye does not produce any tears and is constantly dry and irritated. Will it affect my ability to have surgery?
Thank you for your question. You submitted some photos and you stated some concerns about the appearance of your eyes. And just to summarize your question a little bit, you basically say you have some dark circles that your mother says you've had since you were born, and that you underwent surgery where the lacrimal gland was removed in the right eye approximately 9 years earlier. And you're asking about correction of the dark circles with surgery, and because you want to have LASIK, but you're also concerned that the right eye doesn't produce tears as effectively since having the lacrimal gland removed. Well, certainly I can give you some guidance with this question. I'm a board-certified cosmetic surgeon, and I'm a fellowship-trained oculoplastic or oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. For clarification, oculoplastic surgery is a specialty where you first train in eye surgery before you train in advanced cosmetic and reconstructive surgery of the eyes and face. So let's address first the photos that you submitted. And the question that I would have, because there aren't any clear side views, is whether or not there is any puffiness under the eyes concurrently with the dark circles under the eyes. It's an important question because when we help people have their eyes look better, we look first at let's start with the dark circles. We look at skin quality, texture, what element of the dark circle is related to external factors such as sun, wind, exposure, environmental factors, as well as genetic factors, and then lastly, sinus allergies as well. But in addition, very often there's also simultaneously there's puffiness. Puffiness is represented by constant appearance of bags under the eyes, and depending on the degree, we have different solutions. If it's slight puffiness and dark circles, we have been very successful combining a non-surgical approach, which is a combination of platelet-rich plasma, which is derived from your own blood, and is used to help stimulate collagen and improve the skin quality under the eyes, as well as combine it with a hyaluronic acid filler such as Restylane or Juvederm to help fill in some of the hollows or the area of the tear trough. And we've seen that combination be very, very effective. Now, when we talk also about dark circles under the eyes, and if there's a textural issue, and if you're the right skin type, which means a lighter skin type, or a skin type that tends not to tan so easily, then options such as laser or fractional CO2 laser is also entertained as part of the whole rejuvenation. You see, the idea is that when we look at dark circles, and it's important to first understand the causes and explain or at least communicate with the patient when we do our consultations on what we can do and what we cannot do. With, let's say, genetic ethnic pigmentation, there's always going to be a limit because we can't bleach the skin. Bleaching creams, in my experience, don't do well with under-eye dark circles. Very often the skin gets very sensitive and it also becomes inflamed or irritated, and then people just don't use the bleaching agents. Besides, I feel like bleaching agents are better used very conservatively and specifically for something called reactive hyperpigmentation. So we want to have a systematic approach. So But I would say that of all the approaches that we do, one approach that seems to work consistently well, regardless of ethnic and environmental factors, is the use of platelet-rich plasma. Now, it's also important to understand is that platelet-rich plasma is stimulating quality of, improving the quality of skin by stimulating collagen as well as blood supply. This is done at the under the skin, and it helps improve some of the thickness of the skin. Now, eyelid skin is 0.5 millimeter in thickness, so you have to be careful about how much we can really, or at least be cautious about the expectations, because we can't thicken up the skin tremendously, but I always say that every micron or fraction of a millimeter does count. And when there's a combination of color and quality improvement, the improvement can be significant. I think it's important that you also understand, as far as surgery is concerned, usually surgery is not the option that I would recommend, because you can't, a lot of times people with dark circles will pull their skin to the side and say, wow, doesn't that skin look great? But surgically, that's very difficult to accomplish. Unfortunately, people can get like scars on the side, and very often when the skin is pulled tight, just like you do in the mirror, you may get short-term benefit, but very often the scar on the side will actually widen and stretch, and the skin ends up back to where it began. So I don't generally recommend surgery for dark under-eye circles. As far as the lacrimal gland issue is concerned, this is going to come up when you are considering LASIK as well. You need lubrication of the eyes in order for you to have a successful outcome for LASIK or cosmetic eyelid surgery or cosmetic eyelid procedures. So you need to have a regimen to properly lubricate your eyes so that you can feel comfortable when you do move forward with your LASIK procedure. A lot of times people who come to us often had LASIK, and then once they had the LASIK, they realized how much significant either the bags under their eyes were, the hooding over their eyes, or the dark circles. So I think you're being very smart by being proactive and thinking it through. So I think you should meet with an ophthalmologist first about managing your dry eye, because you do need therapy to try to compensate for the loss of the lacrimal gland. And then meet with qualified, experienced cosmetic surgeons who know this, who have a lot of experience with treating the dark circles under the eyes. It's not an easy thing to treat, but in our experience, because we focus so much on it, we have been very successful with a strategy that's customized to each individual. So I hope that was helpful. I wish you the best of luck, and thank you for your question.